This presentation highlights the community health project I developed and implemented during my experiential learning for community health nursing. The focus of the intervention was to teach effective hand hygiene practices to children aged 4 and up at Watertown Family Connections, a local family resource organization in Watertown, Wisconsin. The project was designed not only to promote proper hand washing techniques among children, but also to raise awareness among caregivers and staff about how foundational hygiene habits can prevent illness and promote long-term health. The intervention was hands-on, engaging, and backed by evidence-based practices aligning with broader public health goals related to disease prevention and early childhood education. Watertown, Wisconsin is a mid-sized city with a population of about 23,000 residents. The city has a blend of urban and rural characteristics with a strong tie to tradition and a close-knit feel. Many families in Watertown benefit from the public services and community-driven organizations like the local public library and Family Connections. With the median household income slightly below the state average, access to consistent health education is essential for ensuring health equity, especially for young children. The city's demographics, including a growing population of young families, made it a prime candidate for a preventative health initiative focused on hand hygiene. The Windshield Survey provided valuable insights into the community's structure, resources, and visible needs. Driving through various neighborhoods revealed numerous family-oriented spaces such as parks, schools, and community centers. The public library and Watertown Family Connections stood out as hubs for education and engagement. Sidewalks were present and well-maintained in most areas, and community bulletin boards displayed flyers for family events, parenting workshops, and health services. Housing ranged from modest single-family homes to more densely packed apartment complexes, suggesting socioeconomic diversity. These visual observations supported my understanding of the community's assets and underscored the importance of reaching families where they gather. To generate qualitative data, I conducted informal interviews and engaged in casual conversations with parents, caregivers, and staff at Watertown Family Connections. I also observed interactions during story time and play sessions. A recurring theme emerged. Although children were told to wash their hands, many did so inconsistently or ineffectively. Caregivers expressed frustration with getting their kids to take hand washing seriously, especially when there wasn't a visible mess like dirt or food on their hands. These first-hand accounts highlighted a clear gap in health literacy and behavior, particularly among younger children, and supported the need for a hands-on educational intervention. Collaboration was key to the success of this project. Watertown Family Connections played a central role by offering a space and direct access to the target population. The public library was also a critical partner, serving as the host location for the event and helping promote the session through flyers and event listings. Jefferson County Public Health offered data and guidance on hand hygiene best practices. Most importantly, the families and caregivers who participated were active contributors to the intervention's success, offering feedback and helping reinforce the lessons with their children. The community health nursing diagnosis guiding this project was risk for infection among children aged 4 and older, related to lack of knowledge and improper hand hygiene technique, as evidenced by caregiver feedback, direct observation, and local infection data. This diagnosis reflects both the root cause of the problem, limited understanding and poor hand washing habits, and the outcomes we aim to prevent, such as the spread of communicable diseases. The diagnosis helped direct the project's goals, interventions, and evaluation metrics, ensuring a structured and evidence-based approach. The community health plan focused on creating a fun and educational experience that would leave a lasting impression on children, while also involving their caregivers. The primary goal was to improve children's understanding and execution of proper hand hygiene. 2 SMART goals were set. First, that 100% of the children would be able to demonstrate at least 3 correct steps of hand washing, and second, that at least 85% would successfully remove the glow germ residue after the intervention. These measurable objectives allowed for a clear evaluation and meaningful feedback on the program's impact. The educational intervention was designed to be engaging, memorable, and developmentally appropriate. We used glow germ powder to simulate germs on the hands, followed by a black light to visualize where the germs remained after washing. Children loved seeing the glowing spots and were highly motivated to do better on their second try. A hand washing song and poster board helped reinforce the steps using both visual and auditory learning styles. Caregivers received an educational brochure with tips for encouraging good hygiene at home. All materials were developed specifically for this event, creating a comprehensive and interactive experience. The intervention was conducted during a resource fair at the Watertown Public Library, drawing in children aged 4 to 10 and their caregivers. We set up an interactive station with glow germ supplies, soap, and the visual aids near the sink. Each child received individual guidance with plenty of encouragement and time to practice. Caregivers were encouraged to observe, participate, and ask questions. Their involvement was crucial because they were the ones who would reinforce these behaviors at home. The session was energetic, fun, and filled with teachable moments that made the learning feel natural and rewarding. The implementation phase of my project focused on delivering engaging, age-appropriate education. I created a trifold educational poster with bright visuals and clear steps to guide hand washing. A matching trifold brochure was given to caregivers designed to reinforce learning at home. During the session, I used the glow germ activity to help children visualize germs on their hands and the importance of thorough washing. To celebrate their participation and reinforce the lesson, I handed out hand washing stickers. These small touches made the experience both educational and fun, encouraging kids to take pride in keeping their hands clean. In reflecting on this project, both short-term SMART goals were successfully met. First, 100% of participating children were able to correctly demonstrate at least 3 steps of proper hand washing after the session. Second, over 80% of children washed off all visible glow germ powder after scrubbing for 20 seconds, showing that the teaching and demonstration were effective. The third goal is a long-term objective, aiming for a 20% improvement in hand washing behaviors reported by staff within 6 months. While it can't be measured yet, early feedback from staff has been positive. Overall, the project was a success, and I'm hopeful the long-term impact will continue to grow. This project emphasized that hand hygiene is a simple yet powerful tool in disease prevention, especially when introduced early in life. Children responded well to hands-on learning and visual cues, and many were excited to show off their new skills. Caregivers expressed appreciation for the clear, engaging materials and said they would use these techniques at home. The success of this intervention was made possible by strong community partnerships and a shared commitment to public health. Through this experience, I saw firsthand the value of community nursing and the lasting impact of empowering families with knowledge they can use every day.